Hey everyone, Swen Gurman here with a Gotta Move. Today's workout is going to be for Piriformis syndrome, another way of saying that pain in your butt. So what I want you to do today is do the best you can as always. And remember, we are using the AMRAP format, which means as many reps as possible in 45 seconds of work and then 15 seconds of rest. If you are currently experiencing pain, please remember to review the modifications video. I want to make sure that this workout is appropriate for you and you get the most out of it as we go. Let's do this. So, to begin with, we're going to put an ottoman where you can bring your leg up and over that ottoman. Okay, so I want you to lift that knee high, bring it out to the side, step it back, and set your toe down. And then do the same, repeat. We are going up and over the barrier. So whatever you have at home, this could be an ottoman, this could be a bench, anything or nothing at all. Just think, lift that knee high, out to the side, bring it over the barrier and set it down. Repeat. You should feel this in the front of your hip, the back of your hip. The whole hip is moving because we're incorporating flexion, extension, rotation, the movement of the hip. It is a mobile joint. Keep going, everyone. Nicely done. Okay, that's halfway. Moving on to the left leg. Up and over the ottoman. Knee up high, out to the side. Reach that foot back, set it down. Knee up to the side, set that foot down in front. Lift, rotate, extend, rotate, set it down. Lift that knee, rotate it back, extend. This is a nice active warm-up for the whole hip. You're getting all the movements of that hip as we go through the motion. Up and over the barrier. Should start to feel that glute kicking in. Remember, if you need to, if it's getting a little too tiring, that's it. All right, everybody take a break. This is our rest. Next exercise we're going to do for strengthening the hip is the wall clamshell. So in this one, we're going to be grabbing the band, a loop band. Put that loop band around your knees and actually just above your knees, okay? I need you to go to a wall. One knee is slightly behind the front knee as I do this. So lifting that knee out to the side as far as I can. This is going to be challenging. So do the best you can. And remember, do as many reps as you can in 45 seconds. If you need to take a break, take a break. If you need a balance support, put something in front of you so you could balance. Help yourself with balance. Okay, we are now moving on to the next one, which is seated hip internal rotation. So we're going to grab our band and then we need a ball to put between our knees.
Work on.
And then we are going to lift the foot out to the side. So this first exercise right now, I'm using my right foot and right leg and hip. Where you should feel this is working those hip internal rotators. So I am actually feeling it here in my TFL. That's a muscle in the front of your hip. And there are deep internal rotators inside your hip. So do the best you can. Lift that foot out to the side. Again, everybody will be able to lift their foot a different length. So you're doing the best you can. Good job, everyone. Keep it up. A couple more seconds. Okay, moving right along. We are now doing a Bulgarian split squat with an RDL. So you're going to grab a couple of weights if you can. If you can't, that's okay. All right, one foot is back. We are bending down, sticking that butt to shout, okay? And then pull it up, okay? So stick the butt back, reach your butt back, and then pull it forward. This is that hip hinge, everyone. Hip hinge, butt back, pull it forward, okay? Butt back, pull it forward. You really should feel this. This is a glute burner for sure, okay? So push those hips back and then pull forward. Couple more seconds. Hips back, pull it forward. Hips back, recover. Pull it forward. Great job, everyone. Okay, that's a hard one. So now we are moving on to quadruped hip internal rotation and external rotation. This one's a little nicer and easier. We're gonna get on the ground. One foot is on a towel and you are bringing your foot out and in. Out and in. In hands and knees, so out and in. Rotation. Movement, again, go at your own pace. If you need to go slower, you go slower. Out and in. Out. Good. This is those hip rotators. So there's no flexion or extension happening. These are strictly the rotators in your hip. Engage your core a little bit. And again, don't forget to breathe. I forget to mention breathing. Recover. All right. We're moving right along, everyone. Good job. Okay. Now, the next one is lying down. So I'm going to move this. We go to our stomach. As a matter of fact, you're going to have your knee out to the side. And what you're doing here is trying to lift that knee off of the ground. Okay? This is a hard one, especially you can probably tell I'm struggling to lift my knee very high at all because this is a small little rotators, hip external rotators, and actually the piriformis itself doing this work. So just know, if this is challenging for you, that's normal. This is a hard exercise, harder than you think. So do the best you can. Almost there, everyone. Lift, lower, lift, lower. Recover. Keep it up. All right, excellent job. Moving right along. Okay, we're staying on the ground. Since I just worked my left leg, we're gonna do the single leg glute bridge. So in this case, we are lifting your hips up, lowering down, lifting up, and lowering down. So this exercise is for that glute max. So basically when we're strengthening the glutes and the hips, we want to strengthen all of the muscles around that area. So each of these addresses a different muscle group in the hip. Good job, everyone. Keep it up. Almost there. Good work. Lift, squeeze the glute. Okay, done. With that one, 15 seconds here. Moving right along, we are going to side lying hip internal rotation. So this one, we're gonna grab our ball back. We're putting the band between our ankles. Gonna lie on your side and the ball is between your knees. And this one, you're lifting that top foot up towards the ceiling. So again, another rotation exercise. Squeeze that ball together. Whoopsies, losing my ball. Okay, squeeze and lower. You're gonna feel this deep in your hip. This is in that glute area. It's a deep hip internal rotator. This is, again, one of those exercises that is deceptively difficult, but very good. Keep it up. Do the best you can. Nice job, everyone. Recover. All right. We have done excellent. Now we've got keeping the band on, actually. Sorry, everybody. Band on at your knees. We're doing the quadruped fire hydrant. So now, hands and knees. Lift that knee out to the side again as far as you can. I want you to think about engaging your core as you're doing this. So tighten up your abdominal muscles. Lift that knee and lower. Lift and lower. Lift and lower. Try not to rotate your hips too much. You are using and focusing on lifting the knee out to the side. So my foot is generally staying in the same area. Lift and lower. Good job, everyone. This is our last. All right, we made it through. All right, everyone, it's time for set 2. Here we go, we're back to the wall. We started with the left leg, now we need to switch to our right leg. So left foot is forward, right knee behind left knee, and you are lifting that right knee out to the side. Remember, you can use a stick, you could use the ottoman. If you need balance support, make sure that the focus of this exercise is on your glute. So as I do this, I should actually feel this in both glutes, as a matter of fact. So my right one is doing the work, but my left one is stabilizing right now. So I want you to feel both hips. Almost there. Keep it up, everyone. Great job. This is a hard one.
Recover.
All right, recover. Moving on to the seated internal rotation with the band. So we did the right leg first, so now we are doing the left. Oh, preparation. Okay, one foot here, ball between my knees, and rotate that foot out to the side. So remember, this is a deep hip internal rotator, so I feel this in the front. My TFL is an internal rotator. You're squeezing that ball together, and then you are lifting that left foot out to the side. Okay, keep it up. Nice job. A few more seconds. Do the best you can. Again, as many as you can do. All right, everyone, take that break. 15 seconds. Okay, the next one is the hard one. We did the right leg first. We are now going to do the left leg. So remember, the Bulgarian split squat means stick your tush backwards, butt back, people, and then bring it forward. So hip hinge, your back is straight. You're pulling that leg, that hip forward, squeezing your glute as you do so, okay? So push the hip back, squeeze forward, try to keep your shoulders back flat the whole time, okay? Squat, hips back, pull forward. Squat, hips back, pull forward. Keep going. You're doing great, everyone. This is a hard one. Feel the burn. All right. Take a break. That one's a hard one. All right, back into our nicer, easier one. Let's go to quadruped. This is that hip interrotation and external rotation. So find your towel. Keep your abdominal muscles tight. Rotate that foot in and out. In and out. Just some good hip rotation. Little windshield wiper here. Cleaning your floor, just another method of cleaning your floor. Here we go. Get creative. Feel those hip rotators. This is the small little rotators in your hip. I feel it in the front again, a little bit in the back. Good job, everyone. Keep it up. Clean the floor. Recover. Okay, good job. Moving on to prone hip external rotation. This was that challenging one for me. So now I'm down on my stomach again, leg out to the side, and I'm trying to lift the knee off the mat. This is challenging, not gonna lie. It is a small little muscle, and you're already putting it into its extreme range of motion of rotation to start. So clearing the floor is challenging. pushing my foot into the floor to help lift my knee. That is what I'm trying to do. And engage that butt muscle. So we're talking deep in your butt. It is right in here. You should feel this muscle working hard. Good job, everyone. Do the best you can. Oh, that's it. Well done. Good job. Okay, we're getting there to the glute bridge. So we are back down onto your back. We started with your left, so it's my right foot down. And now I'm doing that single leg glute bridge, pushing my heel. So this is my heel going into the ground, lifting my hips as high as I can, squeezing my butt at the top. So we want some good glute squeeze, all right? No one wants a flat butt. Come on, lift those hips. Good. Keep it up, everyone. Lift, squeeze. Lift, squeeze. Keep it up. You're doing great. Lift, squeeze.
Recover.
All right. Excellent job. Okay, we are now doing the side lying rotation. So, putting that band back around my feet, grabbing my ball. Okay, I'm going to scooch this direction, putting the ball between my knees. Knees are bent and lifting that top foot to the ceiling. A ball is not a bad option, but it is a little rolly, so you really have to squeeze it to keep it in place. Lift that foot, hip internal rotation. Again, muscles deep here into the front of your hip. Lift, lower. Good job, everyone. Again, do as many as you can. You're doing a great job. Feel those hip rotators burn. This is good, that good burn. Up, recover. Excellent job. Okay, now we are on to our last one here, which is the fire hydrant. Oops, the band needs to be at your knees or just above your knees. And you are going to be bringing that knee out to the side, okay? Knee out to the side. Abs tight. Trying to lift that knee out to the side. Again, not rotating my whole body, just lifting my knee. Okay? Lift. Squeeze the glutes. You should, again, feel this in both glutes, actually. So your left one, in my case, is stabilizing. I'm using that deep hip in external rotators here, that piriformis, as I do this exercise.
Cool down.
All right, look at us, we did it. Way to go, everyone. Okay, so our cool down now is some stretches, which will be much needed after this workout because that was a lot of work on my hips. So let's go down to the mat and we're gonna start with the piriformis stretch that I like, which is a figure 4 stretch here. And then you're just gonna grab that opposite knee and pull your knee towards your chest. This is actually stretching my right hip into here. All right. Good job, everyone. Hold this stretch and try to just breathe. We just got through that hard workout specifically for the piriformis and the glutes. So well done. You deserve this stretch, everyone. Good job. All right, now let's get ready to switch sides. And switch. Other leg. Grab behind the knee. Pull the knee towards your chest. Feel that big stretch in the left glute, left piriformis. Great job, everyone. That was an intense but awesome workout, even for me, not gonna lie. So remember, if you are experiencing piriformis syndrome, Please modify that workout as much as you need, but get through it because that's how you're gonna get that muscle stronger and that's how you're not gonna have pain going forward. Okay, I'm gonna actually show you one other stretch that I love for the hip, and that is the pigeon pose. So look at that. Well, that's our buzzer, but I'm still gonna show you the pigeon pose. So you're gonna have one knee out in front, a foot is here, opposite leg is behind. I have to support myself because, to be honest, I'm so tight that it's hard for me to just sink into this stretch. So I'm just gonna sit into this stretch here and breathe through it. So this would be kind of your extra if you wanted to just do a little bit more stretching after that workout. So the pigeon pose. This is a yoga move. A lot of people enjoy yoga, and I don't disagree with that. I just think you need to strength train as your primary means of exercise. Oh, that is so tight, but it feels so good. I call these stretches hurt so good because that's basically what it is. They feel good, but they are intense. All right, we're just gonna sink into this last one here and then we'll call it a day. Breathe. Try to get your muscles, talk to your body and get your muscles to relax. That reminds me, I want everyone to remember the power of our brain and how important it is to listen to your body, but talk to your body too, and tell yourself, you know what? We're gonna relax right now. We're gonna let these muscles go. We're gonna just sink into this stretch. It may feel a little tight, but guess what? The longer I do it, the easier it gets. Okay, everyone. Thanks again for joining me today. And remember, you gotta move, I gotta move, we all gotta move.